as you said, it's that's enough.
Roughly you'll get 3 to 4 lakhs in Indian rupee. Yeah.
You're identifying as the brown means yes, we are brown people, so that's no problem.
So in short, if you do the calculation, it will cost you around 3 to 4 lakhs for the whole process if you're not doing it through an agent.
அனைவருக்கும் வணக்கம். யாதும் ஒரே யாவரும் கேளு. வெல்கம் பேக் டு நர்சிங் தமிழா. நம்ம ரீசெண்டாக பார்த்தீங்கன்னா நிறைய பாட்காஸ்ட் வந்து பண்ணிட்டு இருக்கோம், எஸ்பெஷலி இந்த தமிழ் லாங்குவேஜில். பட் ஃபர்ஸ்ட் டைம் வந்து நம்ம இங்கிலீஷில் பண்ண போகிறோம். அதனால் என்னோட இங்கிலீஷ் கொஞ்சம் கஷ்டமாக இருந்தது அண்டர்ஸ்டாண்ட் பண்ணிக்க அப்படின்னா தயவு செஞ்சு ஹெட்ஃபோன் யூஸ் பண்ணிக்கோங்க. போக போக இம்ப்ரூவ் பண்ணிக்கலாம். இன்னைக்கு இந்த பாட்காஸ்ட்டில் நம்ம கூட யார் வந்திருக்காங்க அப்படின்னு பார்த்தீங்கன்னா ஹர்ஷதா அப்படின்னு சொல்ல போகிற டெல்லியை சேர்ந்த ஒரு நர்ஸ் தான் வந்திருக்காங்க. அட் ப்ரெசென்ட்டில் இப்போது அவங்க நியூசிலாந்தில் ஒர்க் பண்ணிட்டு இருக்காங்க. இந்த வீடியோவில் முழுக்க அவங்களுடைய நியூசிலாந்து ஒர்க் கல்ச்சராக இருக்கட்டும், அண்ட் தென் இந்தியாவில் ஒர்க் பண்ண எக்ஸ்பீரியன்ஸாக இருக்கட்டும், அது மட்டும் இல்லாமல் அவங்க இந்த ப்ராசஸ் எப்படின்றத கொஞ்சம் டீட்டெயில்டாக சொல்ல போகிறாங்க. பட் லிட்டில் பிட் இங்கிலீஷில் தான் இருக்குன்றதால கொஞ்சம் அண்டர்ஸ்டாண்ட் பண்ணிக்கோங்க. நீங்கள் இப்போ தான் நம்மளோட சேனலுக்கு ஃபர்ஸ்ட் டைமாக வரீங்க அப்படின்னா நம்மளோட சேனலை சப்ஸ்கிரைப் பண்ணி வச்சுக்கோங்க. அண்ட் தென் நர்சிங் படிக்கிற அவங்களுடைய ஸ்டூடெண்ட்ஸாக இருக்கட்டும், இல்லை ஃப்ரெண்ட்ஸ் அண்ட் ஃபேமிலி யாராவது இருந்தாங்க அப்படின்னா அவங்களுக்கு இந்த ஒரு வீடியோ கட்டாயம் ஷேர் பண்ணுங்கள். ஃபர்ஸ்ட் ஆஃப் ஆல், good morning, Harshita.
Morning.
Okay, how are you feeling now?
I'm good.
Okay, that sounds great. Actually, thank you for your wonderful time for this podcast.
Thank you for inviting me.
Okay, we will make much better this podcast as much as possible because my English is not so good. So that's why I gave an intro in the Tamil language.
Because I don't know in Tamil, so it's better to do it in English.
Oh, okay, that's great. Actually, she is from New Delhi. She knows English and other than Hindi, but she doesn't know Tamil. That's why we are doing this podcast in Tamil. Yes, Harshita, you can share your work experience in New Zealand right now.
Okay, so I came to New Zealand in 2024 and it's been a year now. I have worked in GP practice and now I'm working in aged care, planning to shift to hospital setting soon. So I got experience from different settings. I can say it's better than India. Some things are better,
Okay.
but some things need to be changed.
Okay, I understood that. But you are saying you are going to move from at present workstation to hospital. Is there any difficulties you are facing?
No, actually aged care is easier as compared to hospital, but it depends on your experience. So I have worked in hospital setting before and aged care is quite slow for me. You are doing the same thing again and again. And in hospital, you get different patients every day. So it's better if you want to learn more. But if you want a calm and quiet life, then aged care is good for you. And you want to practice independently, GP practice should be one thing you can consider because you can work as a nurse prescriber there, nurse practitioner, so many options are there. So I haven't decided yet, but maybe I'll go back to GP or hospital because I really don't like aged care.
Okay, that's good.
It's my personal opinion.
Okay.
Some people like aged care, but I'm not one of them.
Yeah, that's good. I understood your point of view and opinion. Actually, I also working in Saudi Arabia as an industrial nurse only. I don't like to work in hospital sector because there will be a lot of works. But for learning, hospital is a better opportunity, I think so. As you say, okay. May I know the leave schedule of your New Zealand leave schedule?
So these are pretty much similar to like in a GP or aged care or hospital, whatever you say. But I think it's same. A little bit of different can be there.
Okay.
Like you will get 30 days of paid leave, that's annual leave, 10 sick leaves, and what else?
Okay. Okay, fine.
That
Okay, fine. That's great. What about the transportations and all? In New Zealand, whether it's maybe a private sector or it's totally government sector, especially that transport.
because I'm from Delhi, so I'll be comparing the transportation from the Delhi. Sorry.
Okay. Okay,
So I'm
fine.
from Delhi, so yeah.
Yes, you can continue.
Okay. I'm living in Auckland. That's the main city in New Zealand. It's like Delhi or Mumbai, if you compare from India. But the transportation here is not good. You have to have your own vehicle, like your own car, and I don't drive. So it's pretty much tough for me because I have to use public transport. Trains and buses are there, but they are not convenient.
Okay, I understood your feelings, but don't worry. Better you can come to India.
I'll try to get my license soon. If you
Okay.
have a car, then New Zealand is a beautiful country. You can travel anywhere you want. Like, it's good if you have a car, I must say.
Okay. I understood. I understand your concern. I'm just kidding. Okay, fine. What about the accommodations? Is there your working place providing any hostel facilities or not?
Before they were offering sponsorships like accommodation and relocation packages, but now I think they hired so many international nurses they don't have any more fund left. So we have to manage our own.
Okay.
So the workplace won't provide you anything. You have to look out for yourself.
Okay, fine. As you said, for the past 1 year, you are staying in New Zealand. Okay, may I know what are the things and personal equipments? It's general notes. If I'm a nurse willing to come to New Zealand, may I know the luggage list? These are the things should be compulsory. You should bring to New Zealand, sweaters and jerkins.
Like what?
Like a sweaters for the winter. I'm just asking the things.
Okay.
Okay.
If you are coming to New Zealand, what you should bring?
Yeah, you're right.
Oh, okay. First of all, you should have a driving license. It's the most important thing.
Okay.
The winters are not too harsh here. It's pretty much like Mumbai or Bangalore. It's not too hot or too cold, and it's opposite as compared to India. So in January you will be having summers here, and in June, July it's a winter season. So right now it's winter here, and I'm living in North Island. So actually, New Zealand is divided into two parts, North and South. So I'm living in North Island. And Auckland. It's like the weather is good here. You won't feel too cold or too hot. So bring an umbrella. That because it's raining every day, you will be seeing rain, rain, rain. So better to bring an umbrella or a raincoat. What else can you bring?
Any other equipments for especially cooking like that? Other than basic personal equipments and all, they will bring.
Everything
I'm
you
just
can
asking
find it
about
here.
that cooking.
Everything is available. You don't need to bring anything from India.
Okay.
Yeah, it will be costly if you compare the cost from India, but why do you want to bring so much luggage? Because you don't know are you going to stay or how will be the room? Is there be any space for you? So better to come like you will be having only 2 suitcases. Better to prepare what's essential for you, not to bring any big like heavy clothes or heavy utensils like pressure cooker or something. Everything is available here.
Okay, thank you for your information. May I know, what kind of climatic conditions, as you mentioned before, but what about that summer times? Is that the summer times heavy or it's still maintaining that cool temperature?
Summer is good here.
Okay.
Better than Delhi, I must say. because in Delhi it will reach around 50 degrees. Here,
Yeah.
it hardly will take reach 27 or 28 degrees.
Sure.
So it's good. Yeah. Even in winters, it can reach up to 7 degrees or 8.
Okay, that's fine.
I'm talking about North Island, not South. So don't get confused.
Okay, I understood that. One important question. May I know what about your salary package? Maybe it's a month or yearly. If you're willing to share, means you can share.
So in New Zealand, your salary depends on your experience. So if you're coming from India or any other country, you need to have at least 1 year of experience.
Okay.
So there's step 1, step 2, step 3. That's how they are going to pay you according to your experience.
Okay.
So I was working in AIIMS Delhi for about 3 years. So I am on step 4 here.
Okay.
So you will be, if you are a fresher, your starting salary could be from $33 to $35 per hour.
Okay.
And then it will increase according to your experience.
Okay.
So, yeah.
Would you don't mind, can you say that in Indian amount, IN or rupee?
Or you can just multiply it by 50. So, I'm not good with maths.
I understood.
Suppose you are getting $40 per hour.
Okay.
And you are doing a 8-hour shift.
Okay.
40 hours in a week. So you can do the math.
Okay, I understood. I too poor in English and little bit max. For that only, I'm just asking you. I just asked about the approximate amount only. That's fine. As you said, it's that's enough.
Roughly, you'll get 3 to 4 lakhs in Indian rupee. Yeah.
Okay. Okay. As you said, 4 lakh is enough, but what about the expenses? Because New Zealand, Australia, and Europe countries, and all, they have a lot of expenses, no, for
Yes,
traveling.
they have pretty much.
Yeah. We can continue.
So yes, the living cost, especially if you are living in a city, in a major city like Auckland, it will be costly. Okay. So for me, I am renting. I have to pay my rent. I don't drive, so I save my money for car or any insurance. But at the end, if I need to book an Uber or something. Okay. So around you can expect $200 to $300 for transportation, and monthly. So the rent here goes weekly. Like for me, I'm paying weekly rent. So in a month, you can say I am spending $1,200 on rent. Grocery, you can expect. I am vegetarian, so here vegetarians they need to follow a strict diet. Not many options. So yes, $100 in a week. Yeah, that's enough.
Okay, that sounds good. It's better.
In short, if you are single, okay, you don't have to support anyone.
Okay.
You can earn a decent amount and you can save pretty much 1 to 1.5 lakhs in a month. Okay. That's the saving.
Okay, that's good. Actually, as you were saying, your monthly expense, I think so. If I
actually, I can't calculate it because
you can continue.
There is no such amount. You will be getting this much money monthly. It depends how much you work. Okay. If you're working 40 hours or 50 hours, you're doing overtime, then you'll get paid more. If you don't want to work or you want to work 30 hours or 32 hours, so you'll get paid less. Okay. Depends on your personal choice.
Okay.
For me, I'm not working 40 hours or 50 hours. I'm not doing any overtime now. I'm just doing I can pay my rent, that's all.
I understood that. As you're saying, if we are doing the OT times, we can get better salary. If you are doing the regular duty, not having much OT, means we can get the basic salary only. You are saying that's good. Another important question: what about the racism in New Zealand? Because usually people working or people studying in the abroad countries, they may at least in their lifetime or in a year they may. Seen such a racism in such occasions. What about you? In the past 1 year, did you face any racism like that just kidding? Anything?
You see, I don't want to sound rude, but the thing is, racism is here everywhere. You can see it even in India.
Okay.
So I haven't experienced this like much, but yeah, I heard some. I have heard some stories. So yeah, racism is here. There.
Okay, that's I understood that because it's a little
Depend
bit.
on your personal choices and opinion. What do you consider as a racist comment or not?
Yeah, I
For
understand.
example, somebody called me brown skin. So I think it's a compliment. Yes, my skin is brown.
Yeah.
What's wrong with that?
Yeah, that's our native and that's our gene to. That's a geographical condition. That's a good. We are
Yeah.
identifying as the brown means yes, we are brown people. So that's what. That's no problem. Okay, fine. As this is as racism is a little bit a sensitive topic. We don't want to get in deeper because as you are staying in New Zealand, I don't want to make you trouble. Okay, fine. Okay, let me go about the process. If I am a nurse working in India, I wish to move to New Zealand. What are the basic procedure and what are the basic needs for that startup procedure?
So you are asking me about the process for New Zealand, right?
Process and basic requirements.
To be eligible to work as a registered nurse in New Zealand, you should be having at least 1 year of experience.
Okay.
Doesn't matter it's from clinical background or teaching background. They haven't mentioned it anywhere. So at least you should be having 1 year of experience. Then your English language. You have to clear IELTS or OET. There is no other option except PTE or any other exam. You have to get B. If you're doing OET, you have to get B in 3 modules and C plus they accept in writing. Similarly, for IELTS, they accept 7 in the other modules and 6.5 in writing. For New Zealand, the good thing is you can club your score. You don't need to get all the desired score in a single setting. You can reattempt it and club your score. So if I am doing OET, I get 2 Bs and 2 C, then I can again reappear for the same module, which I get the C. So I can get the B, that's the required score, and club it together. So yeah.
Okay.
And what else? You should be registered nurse wherever you are practicing. That's the basic thing. Like if I'm practicing in Delhi, India, then I should be registered there. They will consider my experience from the day I have registered myself as a registered nurse and I started working. So internship experience or any other illegal experience, they don't count. And so that was the registration eligibility, I would say.
Okay, eligibility.
New Zealand registration. I am talking about Indian nurses who are coming from India.
Okay, that's fine. Okay, any other to share about this process?
Yeah. So if you got all 3 requirements, 3 or 4. If you got all the requirements, then you can start the process.
Okay.
First, you need to get verified your documents from CGFNS.
Okay.
It's an online process. You don't need to go anywhere. Just send your documents to CGFNS and they'll verify it. After getting your CGFNS, then you need to apply in New Zealand Nursing Council.
Okay.
And they will. For GNM and for B. Sorry, just edit this one.
Okay.
Okay.
That's pretty only. I won't cut it.
Once you are done with your CGFNS, then you need to register for New Zealand Nursing Council, and you need to do 2 online courses that will be teaching you about how the culture in New Zealand works, and especially focusing on Maoris.
Okay.
Then you need to clear 2 exams. First is the MCQ based online exam. That's similar to UK. It's not NCLEX. what people get confused with. It's not NCLEX, it's just a CBT, computer based exam. It's easier and you can do it. Then the next part is you need to do a practical exam, clear the practical exam, that is OSCE.
Okay.
And for OSCE, you need to come to New Zealand. The exam will be conducted in Christchurch, and you need to clear all the 10 stations. After all this, you will apply for your nursing registration in New Zealand, and then you can work as a registered nurse here.
Okay.
I know it sounds a long process, like it's too long.
Okay.
But if you are done with it, you will be happy after coming here.
That's good. Okay. What is the time duration of this process? Because for Arab countries and all, it takes 8 months. For Europe and all, some countries it takes 1 year or 1.5 year like that. May I know what is your time duration for the process to move New Zealand?
Okay, so like now they are taking too much time because a lot of people are already applying. So I think around a year, maybe more than that. It will take around a year. For CGFNS, it will take around 6 months, 3 to 6 months. Then for New Zealand Nursing Council, in their official websites, it says 5 months, but you can expect 6 to 8 months for sure.
Okay.
So in total around a year or maybe before that, but keep in mind you need to be prepared for your OSCE and for your exam. What was that? What was the exam? Clinical. CBT and OSCE, you need to prepare for both of them. Then you will take some time. So I think a year is what would I say, it's best. But for me, when I came, the process was different. We don't need to give that exam. We just need to do a course. So it was easy for me.
Okay, fine. That's as you shared a lot of informations and each and every steps of process. As an Indian nurse who want to be a New Zealand nurse or RN, it's very much useful for them. Okay, that's fine. What about that? One thing. Yes, you can. Yes, you can continue.
I forgot to mention the cost.
Okay, yeah. For that only, I'm just coming. The next point of view question is that only. You can share that.
Oh, okay. Sorry. So, in short, if you do the calculation, it will cost you around 3 to 4 lakhs for the whole process if you're not doing it through an agent. If you're applying yourself, then it will cost 3 to 4 lakhs. If you are doing it with the help of our agent, then around 5 lakhs or depends on their fees.
Okay, that's I understood that.
In short, you will be spending your 1 month salary.
Okay. That's fine. Actually, I wish to summarize, as you said, the process. First, we have to be a registered nurse, our respected nursing council, and we have to do that OAT or IELTS course, and we have to get the required score for the New Zealand, and after that we have to do some like ASCII procedures like Viva questions, and we have to complete that basic another one exam, like as you mentioned that questions about that country and country peoples and their culture, religion, languages, like that, as you're saying. And also you mentioned that time duration and amount which we have to spend for the process of New Zealand. Actually, you covered everything. Thank you so much.